Beardsy, man. He's eating shoulders above Keegan. Not height-wise, I'm talking about talent, you know. I wish he'd get his dominoes fixed up. Looks like Queen Dracula when he's smart.
He's good, Harry. But it was sold him for £1 million, man. We could get us on a proper team.
Ah, anyway, bollocks.
It's the only chance we've got to stay in the first division, I'm telling you.
Oh, what that? Oh, hello, Mr. Patterson.
Aye.
You're out short, aren't you?
There's a pint off, will you?
Yeah, I'll get it, I'll get it.
I'll come and shop to watch the telly.
Oh, I need that indoors, Mum. I'll have a game of daughters, man.
No.
There you go.
No, I want to watch this programme. About AIDS.
AIDS, and yet more AIDS. I'm sick of death to hear about AIDS.
Death, that's what we're talking about. Look, when I've just finished this course called AIDS at Work.
What were your experience in international construction? You've been on an AIDS course. Oh, dear, mate. You should be told you're ruining the globe, man. Building houses and bunking birds. Have trouble, will travel.
Look, man, I've got to convince 70 bricklayers tomorrow. They've got to watch out, watch what they're doing.
What for? Don't get these shirt lifters on a building site, man. Union wouldn't allow it. They get your drug addict.
Look, man, it's not just homosexuals and drug addicts. AIDS affects everybody, right? Everybody who has sex.
Aye, maybe he's in America, but not on Tyneside, man. Well, not yet, anyway. I mean, they're just recently getting out of the Black Death in Baker, man.
Hey, people like you frighten me.
How's that, Nick?
Because you didn't listen to anybody.
What are you talking about on there?
Aye.
Oh, listen to what they do on there, What do you get on there? Doctors arguing against each other all the time. I mean, they didn't even know where it comes from, do they?
Look,
Or do they?
let's just watch the telly, right? You might learn something.
And then come over a game of darts.
We don't know. We suspect. And we suspect that it came from a green monkey in Central Africa, that somehow the virus that we know is very like the AIDS virus, it's not exactly the same, transformed itself from a green monkey and got into mankind. From Africa, it's anybody's guess how it got into America, Haiti, North and South America. All we do know is that this is a new disease in the Western world, and the earliest specimen that we have as a positive, looking backwards, is the late 1950s from Central Africa. That's the clue as to where it came from, plus this different virus in the green monkey.
You have quite an interesting analogy about the spread of AIDS and the jumbo jet. Perhaps you'd like to elaborate on that.
Now, I think that if you look at the curves, which are going up all the time for the number of people who have AIDS, it's rather like watching a jumbo jet taking off. Now, with the gay population who were hit first with this disease, the jumbo jet's well airborne. With the intravenous drug abusers, the jumbo jet has just taken off in this country, and with the heterosexual spread, it's still on the runway, but it's moving. We want to stop it before it takes off. That's the reason for the education campaign.
Say it's evil, man. It's evil.
Nah, well, that's not a lot of punters, really, and it's hypothetical figures, them. I mean, don't forget, you know, we live in a place with 60 million punters in the UK.
But it's spreading. It's spreading, that's the point, right? And there's no cure.
But what is it exactly? What is it? Because I don't even know what it is. I mean, are we talking about a germ or some sort of creepy crawly thing or a little bug or what is it?
Bug, aye, it's a bug, right?
The bug.
AIDS stands for Acquired Immune Deficiency Syndrome, right?
Well, that's kind of been a lot of the lads in the Gallagher there, don't they?
But look, it's not what it's called, man. It's what it does. It stops your body from fighting the other little bugs, and that's what normally kills you.
Right.
Just watch this, man.
All right.
It's a remarkably simple and clever virus because it's so fragile outside the body and so easily destroyed. But once it gets into the body, once it's injected into the body, the difficulty is that it homes in on just the sort of cells which normally protect you against diseases. And it destroys those cells. And in doing so, it lets in other diseases. These are diseases which take the opportunity of the defense system being laid low. And once that happens, of course, we can treat some of those diseases, but we can't go on treating them time after time, and eventually the patient gets weaker and weaker and dies.
See what I mean, eh? It's wicked, man. And there's no cure. Wait, I haven't found one yet.
Well, I'm out for letting them get on with it. Please, no, I can deal with it.
Well, of course there is.
What? Well, what can I do with it?
Make sure you don't get it.
Well, how can I get it? I don't know anybody what's got it, so how can I get it?
But that's the point, man. Nobody knows who's got it, so you've got to be dead careful.
Well, I'm very careful about things like that. He'll tell you behind the bar, I insist that's washed every time I get a refill.
No, that's got nothing to do with it, man. You've got to be careful about sex, right? Doesn't matter if you're a man or if you're a woman, right? If you don't know what your partner's been up to, you're at risk.
Well, you're not suggesting I gone up to some talking about I fancy tapping up, you know, I told you up and say, oh, good evening, have you got AIDS? And then you say no, and then you buy them a drink. I mean, that's going to scare them up quicker than what halitosis would, man.
You know what I mean, right? Just take sensible precautions, man.
Oh, look, if everybody listened to the likes of you, man, the monasteries would be chocker. And I've never liked that mead. Oh, a sweet one.
No, wait, bollocks, you know, I don't care.
No, but look, I mean, what you're saying, I gone into a bar,
aye,
and I see a bird what I fancy, so I kind of gone up there and put the lips on it, because that's dodgy.
Yes,
I stand back 10 yards, because in case you breathe on it, because that might be dodgy. God knows what else is dodgy. I mean, we're not exactly talking romance here,
look, man, AIDS, it's not like catching a cold, man, right? You can't get it like that, right? It's hard to get, right? You can only get it from body fluids, right? Like blood and semen. We have to get them fluids into your body to get AIDS. Just watch the telly, man.
Complicated, isn't it?
With diseases like AIDS, I mean, we don't. The majority of the population is completely safe. And I think that's important because there's overwhelming evidence that there's no casual spread of this disease, either amongst households or institutions or schools, or amongst people working with animals, for instance, veterinary surgeons and people like this. There just isn't any spread unless there's a very good reason for it. For instance, people who have accidentally inoculated themselves with a good dose of the particular virus. So things like swimming pools and public libraries and pubs and schools and workplace, the food industry, absolutely safe. Even if somebody working in them has got AIDS, it's safe. You can't spread the disease. It's got to be injected.
Well, let's get down to the specifics. How can someone contract AIDS?
Terribly easily. If they sleep with somebody who is infected in the first place and they don't protect intercourse. That's number one in our society at the moment. And it doesn't matter whether that person is straight or is gay. It can be transmitted from male to female, from female to male, or from male to male. And if a female gets it, as we've said, the baby will get AIDS as well. That's number one. Secondly, if you fool around with needles in drug abuse, you share needles or you share mixing bowls or other equipment with somebody, then you will transmit the infection into them if you are already infected yourself. And the third way is the babies, who are born to mums who are already infected. And that perhaps is the most tragic group of all. The dangers from things like blood transfusion are very, very remote indeed. And I think we have to stress that very forcefully, because all blood, every donation is now screened for the antibody to the AIDS virus. And of course, if it's positive, then the blood is rejected.
One other fear which people may have is heavy petting or kissing. Can you contract AIDS that way?
But at my age, I have to think back to what heavy petting actually meant. But the kissing thing is something which comes out time and time again at public meetings. It's the number one question, I think. And we can say that there is no evidence at all that kissing transmits AIDS. And we've looked at families, at normal households, we've looked at institutions, we've looked at whole populations of people where we know that AIDS is only transmitted either through sexual intercourse or sharing of needles. You see, the virus has to be in a good concentration to be injected into somebody else's body. And that isn't true of saliva. Certainly the virus is present in all body fluids. And it's been estimated that you actually have to swap about half a pint of saliva, infected saliva, with somebody in order to infect them.
Half a pint? Oh, even footballers don't knock a lot much.
Tell you what, let's put it this way, right? Just supposing you had AIDS, right?
Me?
Just supposing
I'm
you
not
had
gonna
AIDS.
get it.
If you did, I could kiss you, right?
Could you?
Oh, yeah. I could kiss you. I could use your knife and fork. I could sleep in the same bed.
Sounds like Dusseldorf, that.
Right then, supposing one of the lads in the hut had got AIDS,
Would
right?
have been Moxie, wouldn't it? Because he was always ill.
Well, yeah, right, Moxie. Supposing Moxie had AIDS, right?
Right.
Now, we would all be all right. As long as we didn't use his razor.
As long as we didn't use his... I'm lost here. Why?
Well, look, man, it might have blood on it, right?
All right, so I've got you. So I had a shave and he had blood on his razor and then cut me and went into me.
That's right, the blood,
right,
aye.
I've got it. Right. Talking about claret. I had one of my infrequent visits to the dentist the other week. Whoa, you've been doing there lately?
No.
Should have seen the tackle he had on. Butcher's apron, Lone Ranger mask and
Well, that's
big
what I'm
rubber
saying.
gloves.
That's what I'm talking about, man. He's being careful, isn't he? Because there's blood involved.
What, that was what all the tackle was
Aye,
for?
the blood.
Oh, I see. If it's that hard to catch, like what you say it is, what they making all the big fuss about if it's so hard to catch?
Listen, man, I've told you, man, because it's spreading, right? And if we don't do something about it, millions of people will die.
Millions.
Millions of people are gonna die, right? They've got no cure, right? All they can do is try and stop it spreading.
Aye, well, you should be talking to them what's spreading it, shouldn't you?
Aye, but look, man, the people who are spreading it don't know they've got it, right? That's what I'm talking about.
Well, how do you know you've got it? If you didn't know you've got it, when you've got it, how do you find out whether you've got it or not?
Blood test. You have to have a blood test. Look, he's talking about it there now.
People watching this might suspect they have AIDS. What can they do to put their minds at rest?
Well, the first thing to say is that most of the symptoms which occur in people who are developing AIDS are the sort of symptoms that occur with a cold or flu or anything else. What I feel like after outpatients or you feel like after a particularly arduous newscast. So the message from that is very simple indeed. Go and get your doctor to sort it out. And the first port of call should be your family doctor. Now, if for some reason you find it difficult to go to talk to him, if, for instance, you live in a small community and you don't want people around the surgery to know, then the sexually transmitted disease clinics are geared up to counsel people and to talk to them. If they want this particular AIDS test, they can tell them what it means. And it's terribly important you don't just go along and have a blood test, because that's all the AIDS test is, taking blood out of the arm, and then a few days later you get the result. It means so much to know that you're positive, because it will affect your whole future life. You know you're infectious to other people. You know that you will not get life insurance. You know that you won't get mortgage endowment. There are so many things, but above all, you know that you have an incurable infection for which there is yet no answer. And the question about whether or not you'll get AIDS is a big question mark. To know you're negative, the converse of the coin, of course, is marvellous to know. And it's because we know so many people who work in the healthcare industry are negative that we know there's no casual spread of the disease. So if you're worried, family doctor, sexually transmitted disease clinics. If you don't want to go to them, then there are lots of voluntary organisations, and the main one in this country is the Terence Higgins Trust, which operates from London, and of course there are various health lines that have been set up in the different regions of the country. There's a wealth of care waiting there to help people, and if they're worried, they should go and seek it.
If, for example, someone believes they may be carrying AIDS, but they would be too embarrassed to go to a clinic and say, I think I've got AIDS. If they went along and said, I think I may have a sexually transmitted disease, would a routine check, if there is such a thing, for a sexually transmitted disease reveal that that person is carrying the AIDS virus?
No. No doctor in the country would do the particular AIDS test just like that, without counselling the patient first. Because the result, if it's positive, is so devastating to that person, whether it's male or female, that they must understand what they're getting into to have the test in the first place. So nobody's going to do that test as a one-off without informing them. The second thing to say is that, for heaven's sake, if you're worried that you might be infected, don't turn up at the local blood transfusion service and think that you'll get the test and be screened out. That's a very dangerous thing to do indeed. You must go elsewhere to get the test done.
50 years ago, we would have had no idea that we'd be sitting down here talking like this about such a worrying, massively frightening problem. How do we know that in 50 years' time a journalist won't be interviewing a doctor and we're talking about people wearing masks because AIDS can spread like the flu virus? How do we know that won't happen?
Viruses don't change like that. And I mean, just think of your own experience. You've grown up through lots of other diseases, poliomyelitis, for instance. AIDS is nothing like that disease at all. It doesn't spread through droplets. We've got all the evidence, we've got more evidence than any other disease in the history in a short period of time to say that AIDS doesn't spread like that. There's no fear of it at all. If we thought there was worry, then we'd be wearing masks all the time. In fact, we wear masks in hospital when we're looking after AIDS patients, not because we're frightened that we'll pick up AIDS or another disease from them, but to protect...
Just whistle a couple of bars of bleeding and then I'll be right with you, you know. Oh, hey, man, oh, eh.
Listen, if she's got any sense, she'll make you wear a condom.
She'll make me wear a condom.
She'll make you
that'll
wear
be
a
the dear.
condom. Listen, the snip doesn't protect you.
Does
And
it
if and if she's on the pill, that'll not protect her. The only thing that'll protect you, if you've got to have sex with somebody you don't know and trust, is a condom.
So, what you're saying there is, wear a condom and you can keep on trucking, yeah? I understand that. That's simple. Right?
Look, what, you just got to remember, right? Just practice safe sex, man. Just listen, you know? Just practice safe sex, and if you don't know the person, right, don't have sex with them.
You sound like the Pope, man.
Oh,
If you didn't know that person, didn't have sex with... I'm Superman, I'm only a man.
Oh, look, man, just think back, right? What I'm saying, just think back to when you were a
I mean,
teenager, right? You know, behind the bike sheds and all that, you know, just touchies and all that.
What, touchies but knee all the way job? Like
Yeah, you know what I mean.
Right. So a GR then, that sort of thing's all right.
Yeah, but some forms of foreplay could be dangerous, couldn't it?
It's very simple. You can touch and you can hug and you can feel.
Yeah.
You can kiss people. That's all safe. All you've got to remember is that blood and semen are infectious. So, if you introduce blood or semen from somebody infected into your body, or if you're infected and you inject blood or semen into somebody else's body, that's the way that AIDS spreads. Remember it. Injection, infection.
Injected means infected. Injected means infected. That's canny there, I think. I just dashed that one off to St. Norman Fowler.
Listen, man, look, man, just
means
look, man, just listen to the doctor, will you, man? I mean, if I can't persuade you now, right? What chance have I got with 70 bricklayers tomorrow?
I'm listening. I'm listening, aren't I? I'm trying to ask pertinent questions, aren't I? I mean, how do you die from it, for instance, doctor?
Well, you can get cancer. Cancer can kill
You
you.
can get cancer from it.
Yes, you can. And it can infect the brain.
Can it?
Yeah. If it infects the brain, you get dementia. You see young people starting to grow old very early.
Well, it's like senile dementia, so you get like doolally really quickly,
Just like senile dementia.
but
yeah.
only young.
Yeah.
And you get a big cyst, so it's obviously quite painful. I mean, I was of a mind that there wasn't any pain involved. I thought you just snuffed it and that was that.
It can be painful.
Right,
Not
well,
just for you, but for your family, obviously, your friends.
Yes, but you... Right. What... Well, how long can it lie inside you? Will it sort of manifest itself, so to speak?
Well, once you've got it in there, it's in there for life. And at the moment, we know at least 14 years between getting infected and actually getting AIDS. Might be longer than that, though. You can get AIDS in 3 months, 5 years, 14 years. But what you've got to remember is that all that time, you're infectious to other people, even though you might feel completely and absolutely well and look well.
1981, so you could have a jump in 1981, theoretically, and it could be 1995 when it comes to a head.
That's it.
Or else sooner. Right? It's like a time bomb, you know, when it's gonna go off. But it's not, you cannot pass it on like to your kids, I know, can you?
Well, look, there's only 3 ways in which you can catch AIDS.
Yeah.
Sexually, with somebody who's infected, sharing needles with somebody who's infected, or if a lass is infected and she gets pregnant, then her bairn is likely to get infected as well, very likely to get AIDS and die.
So the kid can die.
That's bloody awful.
I think I'm ready for a drink. Do you want a drink? White
Please.
wine and soda, something, is it?
Not bloody likely. I'll have a pint of bitter, please.
Pint of bitter, right?
That's stuff.
2 log and a bitter. Huh? And give us some change of that machine you got in the bog.
I'm sorry, Osler, but I think you'll find it's empty. It's been in great demand, you know. You'll just have to tie a knot in it, won't you?
No, man. This is a matter of life and death.